As disease-modifying therapies for Alzheimer's disease, or AD, enter the market, economic evaluations are going to play a key role in pricing, access, and reimbursement decisions. Cost-effectiveness models for AD treatments face the common challenge of predicting long-term, patient-relevant outcomes from short-term clinical trial data. Motivated by this challenge and by the broader goal of improving the transparency and credibility of models for AD, the International Pharmacoeconomic Collaboration on Alzheimer's Disease organized a model cross-comparison challenge. 8 independent modeling groups from the US and Europe, including researchers from RTI Health Solutions, participated in the challenge. All groups were asked to submit model results based on a common benchmark scenario using hypothetical clinical trial data for a treatment for early AD. We first compared the groups' modeling approaches to understand differences in how they used the clinical trial data in their models, including any key assumptions. We then compared the model results to generate insights into the impact of these modeling choices on predicted health and economic outcomes. Based on our analysis, we recommend that modelers and decision makers consider sensitivity analyses that explicitly focus on how treatment effects for new AD treatments are used in cost-effectiveness models. Such analyses are essential to the credibility of value-based decision-making for emerging AD treatments.